I'm Vincent, a nurse. I joined MSF in 2012. I remember clearly when I was young, someone told me that it's a blessing if you have the ability to help others. Since then, I've always wanted to make use of my knowledge and go to other less developed countries to help people there. I first heard of MSF in 1999 when they won the Nobel Peace Prize. I thought they were amazing when I found out that it wasn't just individuals who can get the award, it could be a group of people. From then on, I started to learn more about MSF. MSF operates in places where there are wars, natural disasters, lack of access to healthcare, and outbreaks of diseases. Apart from medical care on the front line, we also work on mental health and getting clean water and non-food supplies to people in need. We have patients coming to the hospital in very serious conditions, and we have to treat them with limited resources. Whenever I see patients being cured and going home in good health, I feel really happy. But I've also met patients who should not be seriously ill. If they were in a place with all its facilities, most of them would survive. But out here, resources are very limited. Some of them don't make it. I feel helpless and frustrated because it's not fair to them. If they were born in our place, these things would not happen. It's very important for me to go to the front line in person, not only to provide direct medical care, but also to pass on my knowledge to local people and to learn about their cultures and lifestyles. In 2012, I was sent to Yambio, South Sudan, for a mission to support a local hospital there. We mainly help pregnant women and children, and I'm working in the pediatric ward. I remember the information I got before I came said that child mortality rate here is over 100 times worse than Hong Kong. I felt very sad after reading that and really hoped I could do something to improve the medical services there. When I first arrived at the hospital, I was nervous but excited because it's been my dream since I was young. But I had to cope with a new environment and staff, worrying if I was capable of doing it. Moses is a kid from a remote area. He's come to our hospital with a burn. We can see that there's a serious infection of his wound already. His mum is so worried that all she can do is cry. Fortunately, a rapid cleaning of his wound and some injected antibiotics, and a few days later he's discharged. If Moses hadn't come to the hospital in time, his hand might have been amputated, or he might even have died from an infection. Many local women give birth at home. Roba is pregnant and about to give birth. She felt pain for more than 10 hours, but was still not able to deliver. Finally, she comes to our hospital. Any later, and the lives of both the mother and the baby would be at huge risk. We do a checkup with Roba immediately. The concern is that the labour is too long. So we send her to theatre for a C-section.
Yes.
The surgeon makes a cut and finds that the baby's neck is entangled in the umbilical cord. It's critical, but luckily the doctor removes it in time. He hands me the baby, whose body has turned blue. I'm so worried that she might not survive. Fortunately, we work on her for a while, and we finally hear her cry, so we know she's fine. Roba and her daughter are safe, and we're happy. Roba and her girl are lucky. If she hadn't come to the hospital and had the surgery in time, the baby girl wouldn't have had the chance to cry at all. But not every frontline story has a happy ending. A child with malaria arrives at the hospital. His situation is very serious.
Antonita, can you help me to pick the ambulance bag?
He's come too late. Even though we try very hard to rescue him, he does eventually die. I feel very helpless and sad at times like this. But these cases remind me to seize every second in the future to try to save every life. We are the only hospital here. Everyone has to come here when they are sick, so our wards are always full, and we set up makeshift tents outside the wards to receive more patients. Most of them live in remote areas. They have to come to hospital on foot or take a motorbike for several hours. Emma is a severely malnourished patient, and she's got pneumonia. Her family bring her to our hospital. When she arrives, she's very tired and has no appetite. We inject antibiotics right away and start the nutrition treatment. Seeing Emma getting better day by day, from being very sick and tired to finally being able to play happily with me, I feel a real joy, a real boost to the motivation. It makes me believe that even in a place with very few resources, we can still help many needy people. I'm just one of many field workers in MSF's teams. On the front line, there are people with a range of skills who come together with the same aim: to save lives.